Hello everyone, I'm Dr. Punit Verma. I'm a consultant interventional cardiologist at Narayana Institute of Cardiac Science, Banglore. And today on the occasion of World Heart Day, that's 29th of September, I'm here to raise awareness about cardiovascular disease amongst general public. With me I have Dr. Mimansha. She's a super specialty resident in cardiology in Department of Cardiology at Narayana Institute of Cardiac Science, Bangalore. So this World Heart Day is celebrated on 29th of September every year, and it is the theme for World Heart Day is decided by World Heart Federation. So this year the theme is use heart for every heart. You know what exactly the theme tells us is use your heart for every heart means one has to use heart for oneself, one has to use heart for humanity, and one has to use heart for nature. So one has to use heart for humanity, the meaning of which is the person has to help others in knowing about heart disease, creating awareness, making them know about the impact of heart disease, and try to tell them the way in which they can prevent, and try to encourage them in getting their heart disease sorted out and seeking medical advice when required. The second thing is heart disease for mankind, humanity, and second thing is heart disease for nature, that is reducing air pollution. Of late, it is seen that around 25% of the cardiovascular deaths can be attributed to air pollution. So air pollution per se contributes to 25% of cardiac death in a year overall across the globe. So it's necessary for us to reduce air pollution as much as possible so that the effect of air pollution on health comes down. The third thing is heart for oneself. What is meant by heart for oneself is to reduce psychosocial burden, to reduce stressors in life.
Okay, so that was some great information at the very start, some great data that you provided us with, sir. So what are the kind of patients that you commonly see in your clinical practice on a daily basis?
Yeah, see, the main patients what we see in a hospital as a cardiologist can be grouped into several groups. The most common patients what generally we see in a hospital, as a cardiologist or a physician, are patient presenting with hypertension. So hypertension per se is around more than 25% amongst the general public. But what we cardiologists or the physicians see is just the tip of an iceberg. So most of the times, isolated hypertension are seen by physicians and they treat them by themselves.
Yeah.
So one should know how do we define hypertension. So hypertension is defined as by different bodies, but what we accept is the one which is from the American College of Cardiology, ACC-AHA. So they define hypertension as a consistent blood pressure of more than 130 by 80 millimeter of mercury. That should be a resting blood pressure. So this is defined as hypertension, but it is not necessary that one should start on medication for if the blood pressure is just above 130 by 80. One can try with lifestyle modification, dietary therapy as well. And if the blood pressure is consistently above 140 by 90, then definitely he has to be started on medication. Otherwise, he can land up in devastating complications. So the second subset of patient what we do see is coronary artery disease or ischemic heart disease. And this is the most common cause of cardiovascular death across the globe. And it contributes to more than 25% of global death rate. So the third subset of patient is the valvular heart disease. Valvular heart disease can again be classified into two types. One is the rheumatic heart disease, which is most often seen in a developing country like ours. And the second subset is degenerative heart disease, which is seen generally in the developed countries. Yeah. So the third subset of patient, or the other subset of patient, is congenital heart disease. Congenital heart disease are the diseases which are present right from birth, and these are due to generally due to organogenesis deformation or the malformation during organogenesis, and what common people call it as hole in the heart or congenital heart disease. So this is the other subset. And the next subset is electrophysiological disorder, also called as rhythm disturbance, which is generally because of the electrical connections in the heart getting hampered. And the next subset is cardiomyopathies, wherein the cardiac musculature itself is involved, and the patient present with decreased pumping capacity, and they can land up in heart failures. And the next subset is other systemic involvement or other systemic diseases causing cardiovascular manifestations. So this is the other subset. So all in a whole, all kind of patients can present with cardiac failure. So cardiac failure also is a presentation which we see in our OPD. So these are the subset of patients we generally see in the OPD.
Okay, sir. Thank you for letting us know about it. So, sir, how does one know when to visit a cardiologist? Like, what are the common symptoms that heart patients present with?
Yeah. So, there are certain cardinal symptoms of cardiovascular disorders. So, one should know what are these cardinal symptoms. The first symptom is chest pain, or we call it as angina. So, generally the chest pain is retrosternal or central in origin. So, it can radiate to both your shoulder blades, or can radiate to the left arm per se, or it can radiate to the lower jaw as well. So whenever a person has such kind of pain, it is probably due to a cardiac origin, and most of the times the patient will get pain on exertion while walking or while doing some physical activity or while climbing stairs. If the patient gets chest pain, the type of description what I've given, the similar kind of chest pain if a patient gets, then it's probably due to a heart related issue. So this is the time that patient has to visit a cardiologist. So the other cardinal symptom is dyspnea, what we call as shortness of breath.
Yeah.
So shortness of breath is generally on exertion. It can be both due to cardiovascular cause or a pulmonary or the lung related issue. So this is another symptom, but most of the times, a dyspnea, which is more the shortness of breath, which is more on lying down, it generally indicates a patient has a heart related issue. The other symptom is palpitation. Palpitation is nothing but undue awareness of one's own heartbeat is called as palpitation. So palpitation also can be a presenting complaint of any cardiac disease. The other complaint can be fatigue. So other cardinal issue can be, cardinal symptom can be fatigue. So fatigue can be due to many other causes, but undue fatigue can also be due to a cardiovascular cause. So one should, try to find out or try to visit a cardiologist and try to find out if he has any issues with the heart or something when he has undue fatigue. The other symptom is again syncope. Syncope is transient loss of consciousness without having any neurological deficit. So this is called a syncope, and most of the times cardiac syncope do not have any kind of post-syncopal confusion. So such kind of syncope is generally because of heart-related issue. So the other cause of syncope can be neurological issue as well, and there are many other reasons for syncope. So one has to be aware of all these symptoms and seek medical advice whenever one has such kind of symptoms. So these are the cardinal symptoms, like I said.
Okay, thank you so very much, sir. So what are the risk factors for harboring cardiovascular diseases in general?
Yeah, in general, like I said, the most common cause is coronary artery disease, and one has to know what are the risk factors of coronary artery disease or ischemic heart disease.
Yeah.
So the most common and reversible, modifiable cause is smoking. So smoking is the most common cause of cardiovascular disease and contributes to more than 25% of cardiovascular death. So this is smoking, which is definitely preventable cause of cardiac disease. So the second cause is diabetes. Diabetes can be attributed to more than 10% of cardiovascular deaths. The third common cause of cardiovascular disease is hypertension, and the next common cause is family history or genetics, obesity, dyslipidemia. These are the most common causes of cardiovascular diseases. So one can prevent cardiovascular disease by modifying these triggers or modifying these factors. Quit smoking, you will definitely have a better healthy heart.
Yes,
then one can have very good control over diabetes so that the cardiovascular issues can come down. One can have better control over hypertension and reduce obesity and reduce dyslipidemia so that the heart stays healthy. So these are the most common risk factors for cardiovascular disease, and having better control over these risk factors can definitely improve a cardiac health. So one should know about all these things.
Thank you very much, sir. Those were some great points. Adding on to that, what are some ways, what are the latest recommendations that are put forward to have a healthy heart? Could you elaborate on that?
Yeah, see, like I said, there are a lot of modifiable risk factors. Controlling these modifiable risk factors is definitely going to make your heart healthy.
Right.
The most important risk factor, like I said, is smoking. Smoking is definitely something which adds on, and there's absolutely no benefit of smoking. So one should quit smoking as early as possible and try to avoid second-hand smoking as well. What I mean by second-hand smoking is just passive smoking. Yeah. So quitting smoking is definitely going to get your risk reduced, cardiovascular risk reduced. So this is one of the most important cause, and one can definitely modify it. And once you quit smoking, the risk becomes reversed. So one should know about this. So it is never late to quit smoking. So I'm again stressing on this, never late to quit smoking. So quit smoking as early as possible and avoid second-hand smoking as well. The second thing is other diabetes, hypertension. Have a better control over diabetes. Reach your physician whenever possible and try to get your sugars controlled as per the physician's advice. So this is how you can reduce your cardiovascular risk. Get your blood pressure under control. Always keep a check on your blood pressure. Have recurrent visits to your physician or cardiologist so that the blood pressure can be controlled and maintained. The other risk factor is again dyslipidemia. Get yourself screened for cholesterols so that you can get your cholesterols under control by either lifestyle modification or dietary modification, or adding on to that medications as well, can get your get your cholesterols modified and get your cholesterols lowered down the required level. So by doing all these things, you can get your risk reduced. The next thing is obesity. Obesity, like I said, is another major cause for cardiovascular disease. Make yourself more active. Do your exercises. What is recommended is at least 45 minutes per day, 5 days a week of moderate level of exercise, which includes brisk walk or mild jogging, can be done, so that your obesity reduces, your cardiovascular fitness increases, your cardiac risk reduces. By doing all these things, you can definitely control your risk of heart disease. And the other thing is, having a very healthy diet. Include more of fruits in your diet, more of vegetables in your diet. Reduce your cholesterol, your carbohydrate intake, reduce your trans fat, reduce your junk food. By doing all these things, you can definitely achieve a healthy heart. So yeah, this is what you're supposed to do, so that you can stay healthy and have a good sleep as well. The recommendation is at least 6 to 7 hours of undisturbed sleep at night. Keeping yourself mentally fit also reduces the cardiovascular disease burden or disease risk. So this is what one is supposed to do. Controlling all these risk factors can definitely get one's cardiovascular risk down, and can make one's heart really healthy. So this is what I would like to tell on the occasion of World Heart Day. Please quit smoking. Whoever is listening to this, and whoever is a smoker who is listening to this, please quit smoking. Please advise others to quit smoking. Avoid second-hand smoking, and follow whatever I've told, the other instructions, like keep yourself fit, have a healthy diet, and have a good night's sleep. Yeah, that's what is the advice.
Thank you so much, sir. Those were some great points, great recommendations, especially the last part, when it gives a clear and loud message to the general population on how to have a healthy heart. Thank you once again, sir, for your time and attention.
Thanks a lot. Thank you.
Thank you.